facilities will last a lot longer.
Yeah, what's up? Why did they put all this long time?
Because it's the
I noticed that. I saw this on TikTok. And we're getting brand new ones. We're getting nice to be extra hundreds.
oh, those are nice.
Yeah,
Those are the ones.
that's what we had at in
That's what
Pensacola.
I think we had the 400s in LA.
They're going nicer, not smaller.
Yeah.
So I like that actually.
Our company management got tied in with GBC, and somewhere along the line, there was a man who came down and said, you will never buy another shoulder mount camera again.
But I bet you have more photos than us. They'll probably have like 14 now.
Oh, we got about 10.
Okay.
Oh, yeah.
We got 10. We're trying to get to 12. I thought we were short. We are short.
I mean, coming from this to this.
Yeah.
For me, it was like.
Oh, yeah.
But I mean, like, on those occasional, shooting events that we gotta go on, we gotta walk 3 blocks.
Yeah,
This thing actually will pay off.
The problem I had with that when I had to use it was that
Yeah.
it felt so delicate.
They are, I
It
mean,
felt so delicate.
well, like, you can't sit back, but because you can't
Yeah.
do any adjustments.
It's auto everything.
So if there's any problem with it, if you see a soft shot,
Is it auto everything? Or
No.
Can you
no, everything's on manual.
Oh,
I manual everything, and,
Yeah, I can't shoot on auto.
if you wanna, it has an auto mode, which is pretty much just point and shoot.
Point and shoot, oh yeah.
Some of the, they call them MMJs.
MMJs, yeah.
Yeah,
It's
they
great
use
for
it
them.
in auto mode, sometimes they have to.
Yeah, that's how a lot of our, like,
You know, Josh does. Josh uses auto mode the whole time. You can tell by looking at the video how bad it is.
well, you can't go shoot like a football game in auto Irish because every time you go up in the light, it's gonna go dark. You know what I mean? Like, you have to be a manual.
I mean, these things are so not sensitive at night.
Oh, yeah, so that's what I like about the one we're getting. They're really good.
Oh, yeah, 400s, you can shoot them.
Yeah.
You can practically shoot
I
on the
never
street
put my
light.
game past mine.
Right.
I had 0, 6, and 9
Yeah.
for my levels.
Yeah, we had 400s. We had 400s. Really nice. Fuji swings.
That's what it is. I'm excited to
Hey,
win.
can you sell these old ones to,
I don't
sell
know.
the old cameras to Fox?
Yeah, right? I don't know what they're going with them, but they're gonna have about 14 of them.
Yeah.
We're getting 13 new ones, 12, 45 in spare. We're gonna make 10 sometime right now. We gotta use some more.
Yeah, it's just,
Yeah.
old
Mhm.
battery. It is what it is.
I had to use one similar to that when mine was in the shop one day, and when I got my 400 back, I was like, oh my god, this is like such a blessing.
Now, you all have these little cameras in the Sonys, like your place. You know, Sony cameras are pretty good.
Yeah, I never used it.
So I think you'll quote.
I don't know what it is. That one is good. Yeah. I'm supposed to myself.
That's good.
I don't think we're gonna do any stuff that was after anyways, right? I'm watching highway up there, I just everything up there, safety all around. The problem is, they don't use it, they don't know what's going on.
Yeah, but they look next from us for the Lexus. Yeah. Whatever Mercedes, Lamborghini, whatever the hell it is.
They always come in with issues that people who see, they don't use this stuff.
And it came down from.
He's bought another one at the other end, like,
Yeah.
because he's looking, like you said, he's looking at 40,000, 30,000, 37,000.
Right.
I'm getting 3 of this for one.
Right.
Whatever.
I mean, it's cell phones.
Should we get started any minute now? Mayor's stuck in a meeting, so as soon as she's in, we're gonna roll right on in. All right. Thank you all for being
All right,
patient.
thank you.
I don't think this yellow is the best backdrop for.
We already had that.
I mean, oh, they
We've
go.
had that-
I'm
we've had that
looking at the
discussion
shot,
so
I'm
many
like, this
times.
shot looks horrible.
Yeah.
They could've put a blue or something.
Yeah.
We're not in space close.
Yeah, I'm just like looking through my camera, I'm like, something's wrong with my camera, I'm like, no, it's just the ugly wall. It's just the ugly wall.
Yeah, that discussion.
Y'all had it many times.
It's been heard countless times.
I don't remember it being that color.
No, it used to be like a blue.
Blue, right?
Yeah.
Yeah, I thought so.
It was like a dark blue.
Someone should tell the PR person, like, it doesn't look good on camera.
That'll be my question.
Hey, who decides to paint
Do it.
here?
And these front lights are magenta cast, and those back lights have a green cast. So the color's wacky on all the lights.
Yeah, at least they put lights up, you get some sort of, you gotta bring your own, and throw one out. Hope someone has a big enough one.
doing? Get myself straight. All right. I know, it's just us. I'm telling you, thank you all so much for waiting. Really appreciate that. Had a little meeting run over and in preparation for, of course, the close of budget season, which is December 1st by the charter. I am here this afternoon, and thank you all again for being here, joined by Dr. Jennifer Avegno, as you know, is our director of our health department. Also, Colin Arnold, our director of our Office of Homeland Security. You know, it is a critical time at this point, and I have asked my team to be with me as we really stand tall and firm in regards to where we are as a city and with this COVID-19, and also with the impacts of Omicron. Am I saying it right? Omicron, which we understand is a new variant and version of COVID-19. So this right now is the time for every New Orleanian to be paying attention. Anyone wanting and planning to visit the city of New Orleans, this is the time to get vaccinated. And if you're vaccinated, this is your time to get the booster shot. We do not have any time to waste. We want to make sure, again, that we continue to see and experience progress in our city. And I also want the public to understand that we are taking and doing our due diligence relative to this new variant. Very happy to report, you know, as we experienced Bayou Classic weekend, it was a great weekend. That sense of normalcy, or that spirit of celebration on the cusp of Thanksgiving Day weekend, it was a great moment in our city. We were alive. When you walked the city, if you went to the game, if you went to the Battle of the Bands, if you were throughout the French Quarter, if you were in a restaurant, our city was alive. And it was a very special moment that demonstrated the progress that we have made as a city. And with people, our people, following the guidelines and exhibiting a sense and a level of civic trust. It's so important at this time that we continue to do that. We do not want to regress. We've had a taste of a little something special, again, over this holiday weekend. But this is our time to continue to double down, but for everyone to be vaccinated in our city. That is the only way out of this, but so that we can also protect ourselves, as we know that we want to continue to make progress, embrace ourselves for a new year, and listen, as your mayor, bracing myself and ourselves for a new term and another term. You know, it was just a taste of the beginning, again, being back to normal, and we want to keep our city safe and make our city even safer. And that can only happen, again, if everyone gets their shot. We have seen, again, a very significant increase, and Dr. Avegno will mention this, as it relates to our youth, our young people, who are now eligible to receive their vaccines. Over 31% of our youth, ages 5 to 17, have gotten at least that first dose. That is tremendous progress. We're monitoring, as I mentioned earlier, this new variant, and we just want to make sure, this is our plea with the community at this time. You know, January is right around the corner. You know, we start our year with King's Day, that then lends, right on into Mardi Gras season, right on into French Quarter Fest, Jazz Fest, all the ways that we know how to come together as a community, which is all embedded in the culture of this city. We also know how we were disproportionately impacted by COVID-19, no doubt about it. But even with this variant and the things that we do not know, we need to take heed and do everything necessary to protect our city and all of her people. I'm going to step aside at this time and ask Dr. Avegno to come forward and give her message. But this is a time for action and for the residents of this city to get vaccinated. And visitors, if you're coming, we welcome you with open arms, but be vaccinated, get your boosters so that you can come to a city that is safe and is absolutely open. Our goal and our mission is to stay open. Thank you.
Thank you, Madam Mayor. And thanks, everybody, for being here. So as you know, this past week, scientists in South Africa, working with the WHO, identified a new COVID-19 variant of concern, which later was named Omicron. While there's much uncertainty yet about this strain, the WHO came out today with an assessment of the global risk of this variant to be very high, so really something serious. With our state and other clinical partners, our health department continues to monitor multiple sources for any potential local cases, and as of today, we have no reports in our area. This is not, as the mayor said, our first experience with dangerous variants, but like all mutations of this virus, we need to take it seriously and be protected beforehand and be proactive, because sooner or later it will almost certainly be here. So here's what we do know so far. The Omicron variant has many significant mutations that may assist in transmission of the virus and evading the body's immunity, including more than 25 mutations on the spike protein alone. This is not simply a version of Delta or one of the other original dominant strains. This is a distinctive branch on the virus evolutionary tree. And that's why you're hearing, part of the reason why you're hearing a lot of concern across the world. As of today, several countries in Europe and Africa have reported cases. Both breakthrough infections and reinfections have been reported. So some cases have occurred in people who have been vaccinated, and many cases have occurred in individuals who had a prior infection with COVID. One of the good things we know is that we think we'll be able to pick up cases of Omicron more quickly than we did with Delta, because certain kinds of PCR tests actually show this variant right away, unlike with Delta, where it took many, many weeks to get sequencing, and by that time it was already here in large numbers. So here's what we don't know yet, but we're monitoring closely. It's really three big unknowns. Number one, does this new variant make people sicker? That's very much unclear at the moment. Number two, is this variant more contagious? That is, does it spread more quickly than Delta through a population or than the original strain? So we know that the first case was sequenced in South Africa on November 11th. Since that time, just 2 weeks, there's been a very sharp rise in cases there, particularly in certain areas. However, we have to remember that the population of South Africa is only about 25% vaccinated. So we really don't know if this is more transmissible or if it has to do with the relatively low vaccination rate. And then the third big question is, does this variant evade the vaccines we currently have, making them ineffective? It is unlikely that the current vaccines are going to be powerless against Omicron, but the tests are underway right now to determine if they will be as effective as they have been against previous strains. And from what I'm hearing, we should know that in the next week because they're running the tests right now. You know, we've seen a lot of variants pop up over the last 6 months, if you remember, and although most of them have not accounted to much, all you need is one really strong one that sets us back. We lived that during the Delta surge that fueled our devastating spike in Louisiana this summer. So, you know, now is not the time to panic, but to continue on the same path that we have traveled several times before. And New Orleanians are nothing if not experienced at handling difficulty when it faces us over and over again. You know, when it comes to dealing with the pandemic, we have to work with the information we have at any given moment and continue the mitigation measures that we know to be successful until we learn more. So what works? Number one, full vaccination series plus a booster. More and more evidence is coming out indicating that a third dose of a vaccine series stimulates immunity even more than the original two. This was borne out during our Delta surge. We saw this firsthand. We surged before boosters were widely available. And so we know that our high-risk individuals who were vaccinated still suffered higher rates of breakthrough cases than younger vaccinated residents. What we're seeing is that with a booster, they actually will fare much better. So if you haven't been vaccinated at all, please do it now. You do not want Omicron. If you've been waiting to get a booster, Omicron is the reason to hurry and get it as soon as possible. As of today, and the mayor alluded to this, our fully vaccinated adult population, so having 2 doses, in Orleans Parish is over 78%, which is a great foundation. It is far ahead of the state average, it is ahead of the national average, and we have much to be proud of. However, as we're just rolling out pediatric vaccines, our pediatric full vaccination rate is only around 26%. That's a big gap. Our entire community won't be protected until everybody is protected. So now is the time to get your kids started on their vaccination series. You can always find a vaccine provider, whether it's for kids, adults, boosters, whatever you need, at ready.nola.gov on our vaccine calendar. And then we still have masks, right? They are incredibly effective and easy. So we urge everyone to follow updated WHO guidance, came out today, recommending masks in public indoor spaces. That's consistent with CDC guidance as well. You don't need a mandate to do this. I've continued to do this the entire time. It really doesn't take much. So don't throw away those masks. Now is the time to put them back on as we're heading into the winter, into the holidays. These mitigation measures work. The strongest weapons against getting the virus or ending up in the hospital are masks and vaccines. We know that unvaccinated individuals continue to make up the majority of those hospitalized or dead from COVID, whether that was locally with what we saw in Delta or around the country as Delta is surging in the northern states as it did to us in the summer. Omicron is not going to be any different in terms of unvaccinated people being at higher risk. But the potential for it to be more contagious and spread even quicker should have everybody appropriately concerned and taking stock of your own individual risk and those around you. So we'll be watching this very closely over the next few days and weeks. We'll understand more what potential impact this will have on the world and how that will affect our area locally. And you know, it's the holiday season, it's the time of gift giving, so give yourself the gift of protection with your vaccine, a nice fresh pack of masks, and a healthy dose of caution. Thank you.
I like that. Good job. Colin?
Thanks.
I'll get on this one.
Good afternoon. The Office of Homeland Security and Emergency Preparedness continues to partner with our health department and our other city partners, as well as the Louisiana National Guard, to offer drive-through COVID vaccines and testing in New Orleans. Vaccines and testing are provided every week, Monday through Saturday, 8 to 4 p.m., with all 3 vaccine types, Pfizer, Moderna, and Johnson & Johnson. Boosters are also available at these sites, and I think Dr. Avegno has highlighted the importance now of, if you are vaccinated, taking that next step and getting a booster. We encourage New Orleanians to take advantage of these free, easy, and quick vaccine options ahead of the holiday season. As has been stated, more than ever, vaccinations are important to continue to have large special events and to get back to what we do best. And that's why I wanted to come up and talk a little bit about this today, because we have been planning for some big special events. We had a flawless Bayou Classic and a Saints game. There aren't a lot of cities in this country who can pull off major level sporting events and then within the day or two, have a weekend of college football events. And we're back to doing this, and we want to do this. And the drive is there. I've seen it in our public safety chiefs, in our infrastructure and operational personnel. We're meeting weekly with a lot of these special event coordinators and promoters. We're meeting weekly with the NCAA. The men's Final Four is coming here the first weekend of April, right after Mardi Gras. So we're going to have a Mardi Gras where we're going to be back. We're going to have a national level special sporting event after that. And as the mayor said, you know, there's Sugar Bowl, there's New Year's Eve, there's Mardi Gras. NCAA top Final Four, and then we're going to go right into our portfolio of special events that we do on a yearly basis. We're going to do French Quarter Fest and Jazz Fest, and I don't want to leave any of them out. Essence, I mean, we have come so far as a community, and so many people have sacrificed and given so much over the last 2 years, and I know that there's fatigue out there, but this is the time that we got to push forward with this. As I said, we had EOC activations upstairs here for the Saints game, for Bayou Classic. Everything went really well. We did Crew of Boo. We worked with the health department to do some surveillance there as far as people wearing masks and vaccinations and tracking kind of the aftermath of that, because we want to have these special events and we want them to be safe. So another part of Mardi Gras for this year, we just found out right before the holiday weekend from the federal government that New Orleans 2022 Mardi Gras has been given that SEER 2, the Special Event Assessment Rating upgrade, a SEER 2 event. Typically, out of hundreds of thousands of special events in the country, 9 or 10 a year are given this designation. We had it in 2020. It opened the federal government's eyes to the scale and size of Mardi Gras. They're back again for 2022. This offers us an enhanced federal support that we are looking forward to in the areas of law enforcement, emergency medicine, you name it. And so we're going to start planning for that here within the next week with our federal counterparts. So really just wanted to come up and say, as many people as can get vaccinated, as many people that can continue to wear masks when appropriate, please, this is how we're going to get through this and continue this trajectory towards getting back to what we do best. And we are the best in the country at special events. So again, if there's any information you want about special events, vaccines, COVID-19, you can find those at ready.nola.gov.
Thank you, Kyle.
Madam Mayor, thanks.
Thank you all very much. That really does conclude our message this afternoon, which is one not for you all to panic, but you know what I'm saying, run, don't walk. Get the vaccination, because we want to continue to be a safe city to live in and definitely the safest to visit. We were just named the top, one of the top 10 cities for the holiday season. I mean, we're on a roll here and our future is bright, but it can only be as bright as we need it to be through our people getting vaccinated. And of course, our visitors being vaccinated, get that booster shot, and let's do the right thing, and we can do it. So that was our goal today, to share this message with you, because we want to be proactive, and this is our way of doing that, and not be behind the 8 ball. Keep it going, good things going. And John, I'll turn it over to you if there are any questions.
Related to COVID-19, only starting with the applicant.
Are there any plans to ramp up enforcement of the vaccine mandate already?
Yes, so as it relates to the vaccine mandate, whether it's, of course, being vaccinated and or a negative test, those mandates are in place. However, we will be ramping that up, just being more, vigilant, talking about the mandate not going away. We have to make sure that that stays in place. And so we will continue to do that, and you'll see a little bit more of that. But as we're getting any responses or any updates to where there is a business that's not following, the guidelines, we are going out, assessing, and collecting the data necessary for accountability measures. Anything to add? You tipping over. Okay. Yeah. Okay.
Also in regards to the mandate, how have you really seen that impact the city's rates, and how do you think it's really working?
Well, we can speak to it now. It's why we are able to be where we are. It's not by accident. It's because of the mandates that we've had in place, and they're working. And we want to continue to see that progress and people to be and practice that civic trust. Doc, you want to add on?
So, I'll say our rates have been low. And not only have they been low, right, because the rest of the state has come down from Delta, and we should all be proud of that. But our rates continue to be significantly lower than the state average, right? So it's not just that they're low, it's that they're very low. The other reason I think we can point to that they're working is when we did the surveillance for Crew of Boo, we surveyed almost 1,100 people in the crowd. This is a crowd that has been estimated to me at anywhere between 80 to 150,000 people, right? So getting 1,100 people is pretty good. 93% of them report being vaccinated. Now, maybe that's a little bit of a selection bias, right? Maybe the people who weren't vaccinated might not have wanted to take our survey. However, what is more clear is that to be at a parade, to do anything else, you had to be vaccinated, right? If you wanted to go get a drink while you were waiting for the parade, you had to show your proof of vaccine. If you wanted to have dinner while the parade was going on, you had to show proof of vaccine. If you wanted to go to the ball associated with the parade, you had to show your proof of vaccine, right? Out of that event, we had no major surges, and we had no self-reports of positive tests. We did have, out of the 1,300 almost people that we have data on, we had 2 positive tests, and they were 2 and 2.5 weeks later. So, it, may have had nothing to do with the parade, right? That goes to show that under conditions, very low disease prevalence, very high vaccination rates, and mandates in place to do a high-risk event like a parade, you can do it safely under those conditions. So it really does highlight, and that's what we're seeing in other cities that have vaccine mandates as well, that they are having similar results when they have large events. That's why you're seeing, Times Square is going to be vaccination only for New Year's Eve. All the other big events, big sporting events, a lot of them are going to be the same way because it works.
Yeah. And then we're seeing it even at our testing sites, but also when we stand up the vaccination sites. We're seeing people getting vaccinated. Bayou class, people got vaccinated. So we know that it's working, and we're going to continue to have those mandates in place because of that. And especially now with this new variant, now is not the time to take our seatbelts off,
Any other questions?
All right, so maybe stating the obvious here, I know statewide the mask mandate has been taken off. Is there any sort of conversation or threshold that we have to be met case-wise in order to bring back that, if that's...
Well, we're going to follow the data, like we always have, and make decisions accordingly. We're encouraging people to continue to put that mask on. Again, now is not the time to take it off in terms of that seatbelt. We want to not get on the highway and then take your seatbelt off. No, we're rolling towards progress. And so, but we'll continue to follow and make decisions as needed. Yes, ma'am.
At any point, will the booster shot become part of that vaccine showing proof of vaccination?
Well, right now, it's showing, right now, if you're vaccinated, and we're encouraging people to get the booster. But being fully vaccinated is at that step in the right direction, and what we will continue to look for. Of course, if there's any changes that come with some of the unknowns, as Dr. Avegno kind of rattled off several of them, as we learn more, we'll adjust accordingly. But right now, the vaccine, based on the 2-part, I think that's acceptable. Doc, anything to add?
Yeah, I would just say that, you're seeing cities with mandates move from 1 to full dose, and I think there is a case to be made for that incremental. I'll say in Louisiana, actually, we have a pretty good rate of people who get the first dose getting the second dose. In New Orleans, it's right around 89 to 90%. Obviously, we'd like the full 100% to complete that series, and so whatever we can do to get people to do that, we'll do.
Yeah, can you give us just a little bit more detail, though, about the enforcement of the vaccine mandate, how it works operationally? Like, what exactly happens to enforce it? And
It's the same thing we've been doing. Well, I think in terms of enforcement, it's the same, ride that we've been on, and learning, from our people, quite frankly, the businesses that do conform. So it is recognizing and really celebrating and loving on those good actors, and any bad actors. There's a process in place, and we get the information. We have to go and investigate, and we take steps accordingly to hold them accountable. And we'll continue to do that.
is it mostly a responsive regime as opposed to...
311 continues to be that tool. Even, if I get an email, or if we send it up not just the 311, but send it to the Department, Safety and Permits. I meet with my director, every Monday, and of course at the close of the week, to see how, where we are. We go over if there are any bad actors or the like, but just making sure that the businesses understand that the mandates are the mandates and we are paying attention. The businesses have been doing really well. I have to give it up. I really have to give it up to them. And we're going to continue to do that and work with them, but also just that arm of accountability.
And have you had to shut anybody down over this?
No, not that I can tell you right now. I know that we've had some warnings, but in terms of a swift shutdown, no. Yeah.
One more. I know we've been talking about a lot of unknowns when it comes to Omicron, and this might still be even a little too early to ask this question, but what are going to be the main warning signs that the city will be looking at with Omicron approaching Mardi Gras that might make the city kind of look at our plans for 2020?
Sure. Well, it's if your people get sick. The same thing that we've seen the movie before. The popcorn is stale, at this point. The butter is gone. So we know what we are looking for. We will continue to follow the data and the science. Hospitalizations, rate of spread, and then the things that we will learn as we see this variant moving across the world, but bracing ourselves for it so that we can have some level of penetration as best as possible so that it doesn't knock us down and so that our people don't die. Doc, you want to add anything?
Yeah, I would say, again, we just learned this in Delta, right? I mean, our hospital capacity is paramount. Our hospital staff cannot take another surge.
No.
There are not enough of them left. And I'm in the hospitals all the time. I say this as a provider. They can't do it, both physically and emotionally. We are at a very good place right now for hospitalizations. We have got to keep it that way. Let's remember, winter is the time when we generally see a rise in hospitalizations for a variety of reasons, whether it's other respiratory illnesses or, holiday-related things. That is a huge bellwether. And having something that's like Delta again would just be devastating for all of us.
Well, and I think you kind of hit it too. Our public safety team can't even handle another blow. Go ahead, Cal.
I was just going to add on to that.
Come on.
The reason why I wanted to come up here is in this planning process, which we're going to continue to do with these big events. We talked about this morning, if you look at Delta, you look at 50 to 100 days from now, where are we going to be? It's Mardi Gras. And so we have to get this word out now and really get people prepared for let's push through. We can get through to the end of this. It's just we need to continue, and we need for people to follow these mandates and to get the vaccines and to get the booster, because we don't want to be in that situation that we've been in so many times over the last 18, 24 months where, a month from an event, you're saying, maybe we're not going to be able to do this now. We don't want to be there. And we're right in that area, 50 to 100 days, with a new variant or a new branch that, can make that possible. And we don't want to see that again.
Yeah, and I don't want to be the ogre in the group. And I'm sick of being that. But love seeing the progress. And we just want to keep it going. And we can. And so let's be the light. And again, happy Thanksgiving. And hopefully the spirit of Thanksgiving, fills our hearts, not only through the rest of the year, but throughout the next year and the next 4. Thank you again.